I am Chad Ricardo. Welcome everyone to the All DMV Town Hall. This is part two, the second of these segments, again powered by the DCSAA, high school sports in the shadow of COVID-19. A special thanks to Clark Ray, director of the DCSAA, for making tonight possible, not only to himself, but his entire team as well. Tonight's special guest is Dr. Ben Gupta. Dr. Gupta is a pulmonologist, and he also serves as a regular health policy analyst for NBC News and contributor to the New York Times and CNN New Day. He is also an affiliate assistant professor of health metric sciences at the Institute for Health Metrics and Evaluation at the University of Washington. Dr. Gupta, thank you very much for joining us here this evening.
Thanks for having me. Great to be here.
Doctor, high school sports are being played all around the country. Some believe that that's amazing. Others believe that that's reckless. It really just depends on who it is that you ask. Speaking specifically to the virus itself, what is the lay of the land? Where do we stand current day in the United States?
Chad, thanks for that introduction and for convening this really important event. And thank you again to Clark just for wanting to make sure that parents and students have all the facts, because you can't get enough right now. And so to answer your question, I'll zoom back a bit. What's the 30,000 lay of the land on COVID-19 for everybody in the country? And then see if we can laser in on your region specifically. I will say more than anybody, healthcare providers, and I'm sure this is a sentiment shared with everybody on the Zoom call. We're tired of talking about this as much as I'm sure you're tired of hearing about it. So no one gets any joy talking about coronavirus, and I know there's a lot of pandemic fatigue. I say that because there's possibly not a more vulnerable and dangerous time for this pandemic than the one that we're entering. And it's a hard thing for me to want to say, because I don't want to believe that reality. And I'm sure it's hard for you to internalize that. But I believe it to be true for a few reasons. Number one, any cold climate, and I'm largely from the Midwest and the East Coast, even though I'm talking to you from Seattle right now. Cold climates are havens for the transmission of respiratory diseases like coronavirus, like flu, you name it. The viruses like drier, colder air. And it's easier to be infected with any of these viruses that tend to, frankly, we think they're in many cases all over the place. Not necessarily in DC, Virginia, and Maryland, based on some of the metrics we have available, but in a lot of parts of the country, a lot of parts of the world, coronavirus is being spread like wildfire in communities. What does that mean? That means more people will get infected. And if it's the wrong type of person who gets infected, they're older, they have a pre-existing condition, it could mean they end up seeing me in an ICU, or at least end up in a hospital. So cold weather makes it easier to transmit. And in cold weather, we're actually more vulnerable to infection because our immune system doesn't like the cold weather. So that combination is a bad 1-2 punch for what lies ahead. Why is it concerning? Well, every single day, let's not even talk about politics. Let's not talk about the headlines. Every single day, there's about 40,000 new cases. That's an astonishing number. That's more than the number of cases in all of Europe. I mean, that is an astonishing number of cases. And this is supposed to be the reprieve. The summertime is supposed to be when things were looking okay for us. And we're still having about 1,000 deaths. So if you think about where we are right now, we're at a pretty high baseline level of transmission of coronavirus nationwide. And we're entering a phase where we think it's going to increase because of environmental factors. So high baseline up front means that the risk for the second wave that you keep hearing about is quite high. Add on top flu. Add on top all the other reasons why people end up in the hospital more frequently in colder months. And I will say, as an ICU doc, I'm worried, because one of the big questions here is, will we have enough capabilities to care for individuals if they get sick? And that means, do we have the right staffing ratios, enough nurses, enough docs, you name it. Right now, things look okay in a lot of parts of the country, but for many months in key and very highly urbanized and very dense in, locations like Florida, New York City, of course, parts of California. Seattle here was the first wave. ICU beds were strapped. People, and we were having to make do with very, very minimal capabilities, a little PPE, things of that nature. So we're not out of the woods yet. We're entering a dangerous period at a high baseline rate of infections. And so it's concerning to us all. But I'm happy now to sort of drill down more specifically about COVID-19 in a pediatric amongst adolescents and students, if you'd like to go in that direction. But I'd say broadly speaking, we're in a concerning part of this virus, of this pandemic, and we need to be more vigilant, not less.
I believe that one of the key statements that you made there was the dangers involved, especially in dense populations. Anyone that is familiar with the DC, Maryland, Virginia area here knows that, if anything, we are very dense. I do want to move on now to the whole pediatric/adolescent perspective, because that's who a lot of us that are on the line right now are concerned about. For a while, the prevailing thought was that young people were at either no risk or very little risk at all. Even at some point, some said that young people were immune. That in itself has proven to not be the case. So what are the facts about the virus as it pertains to teens, potentially student athletes?
That's a really vital question. I'm glad you asked it. So here are the facts. And I mean, as somebody that has seen again, elected leaders move into the lane of public health and clinical medicine, this is probably one of the areas that has caused the greatest amount of anger for all of us, that there's disinformation on this issue specifically. So let me clear it up. What we know is that if you're basically youths in any study that has looked at who is at risk for getting infected or transmitting the virus to other people, all those studies have defined a youth as somebody that's less than 24 years old. Okay, so let me start out with that. What we know from those studies is that if anybody between the age range of 10 and say 23 years old, but let's just say teenagers to make this simple, we know teenagers can get infected as easily and can transmit coronavirus as easily. You'll hear the word efficiently in the headlines, but basically it's as easily as adults. Meaning if your child or if your student athlete is exposed to coronavirus, they are as likely to get infected as somebody that's 35 or 45. So that's important for a few reasons. Number one, what we do know is that among those individuals that end up getting sick that are young, among those individuals that end up getting sick that are young, they end up in the intensive care unit at the same rate as adults. So adults that get hospitalized for coronavirus, about 1 in 3 end up in the ICU, they see me. Children who are positive for coronavirus who end up getting hospitalized, that absolute number is of course less than adults. Children are less risk of ending up in the hospital. But when they do, about 1 in 3 end up in the ICU. So they are not protected and or immune from getting infected from coronavirus. There's personal risks to their health and safety. So your child is at risk. Again, that risk is less for children of any age than for adults, but they're still at risk. And if they were to have any serious complications, and we know that there are many cases of that have been documented of severe adverse outcomes from coronavirus amongst younger people, that they can end up in the ICU. So anything is possible, and vigilance is demanded of anybody, regardless if you're 70 or if you're 20. Now, specifically, the question I get asked a lot is, what does it mean if I send my kid back to school, or if they're participating in athletic events around other children or other student athletes? What does it mean for me? Because, hey, doc, I'm 60 and I have COPD, or I have diabetes, or I have high blood pressure. And now we actually know from a study that was just published yesterday out of India. And again, different country, different challenges, but some of the facts remain the same, regardless if you're in India or if you're in the United States. We know that children from this large study were one of the key transmitters of coronavirus, particularly in households. So if your child is infected, but they're asymptomatic, which is often the case, maybe 80% of cases in children. The percentage varies based on the study, but the vast majority of children, student athletes that get infected with COVID-19 are asymptomatic. That a small proportion that have severe illness that end up in the hospital. But even if they're infected and they're asymptomatic, they pose a risk to their older family members, to their household members. And now study after study has proven this, that children can very easily transmit coronavirus within a household setting. So that matters. So if grandma, grandpa, or if mom or dad, if grandma and grandpa are in advanced stage, advanced stage in and of itself is a bad thing when it comes to coronavirus. But if mom or dad has a chronic condition, that is a serious consideration, which is why testing matters regardless of the age of the individual, especially as we send our children to school. This notion that you don't need to test children in schools is crazy talk. Everybody needs to get tested, either for their own protection or for the protection of loved ones at home. The one qualification here is that children so babies all the way up to about 10 years old seem like they're not as easily able to transmit coronavirus as teenagers and those that are older. So that really, your really young children seem like they're not nearly as impacted by the disease if they're infected, number one. So their rates of serious complications are even lower than teenagers. And then number two, if they're infected, they're less likely to expose and then successfully infect their parents or their grandparents. So that's the one qualification. But teenagers, they're not out of the woods. They're at risk. There's been a lot of disinformation, and so COVID-19 poses a risk to themselves, to your student athletes, and also if they come down with the disease or with the virus, they are a risk to other household members who might have a worse outcome.
Dr. Gupta, this is truly about fact or fiction here, because I believe that the point that you're speaking to right there is in our realm of sports and athletics. That's the big piece. So let's double down on that. Fact or fiction, asymptomatic, pre-symptomatic spread. Is this a real thing? And in teenagers, if they're asymptomatic or pre-symptomatic, are they still able and just as likely to spread it throughout the community?
Oh, there's no scientific doubt that, and you can make an argument that maybe 2 months ago the science was unsettled. I think anybody now that says that teenagers cannot transmit coronavirus regardless of symptoms is lying to you. There is now an excess of data that suggests student athletes, your high school students, that regardless if they're participating in sports, but I recognize this is that we're talking about athletics here. Yes, absolutely. Screening children or student athletes for symptoms and assuming that because they don't have a fever or a shortness of breath or a cough that they're good to go is not sufficient. We know that the majority of individuals 20 and less that are positive for coronavirus and can transmit it to their parents or to their grandparents often don't display symptoms. So symptom screen alone to say, yes, you're good to go play football or you're good to play basketball, no, that is not enough. Symptom screens are not enough. And frankly, they provide false reassurance. Like the fever gun, I don't know if we're doing a lot with the fever gun, especially with our young individuals. Testing on top of a symptom screen, I like that. But the fever gun alone, let's just, like, that's fact or fiction. That's the fever gun in and of itself. Maybe if you're 65 and older and you're coronavirus positive, you might demonstrate a fever, but even in that case, it's maybe 50-50. I don't want to throw out percentages here and be quoted on it, but for the teenager who is positive, they are unlikely to demonstrate a fever. So the fever gun in and of itself cannot be a strategy.
I tell you what, the fever gun allows for me to go to the gym every day. So I personally am a fan of the fever gun, but I definitely agree with you there. Look, that was the that was the part that all of the people watching right now that they don't necessarily like to hear. I want to get to a positive side here. Eventually, we hope to all return to play. We hope to all get back to the field. Many states, I believe the count now is 42 within the United States, are back on the field, albeit again, right or wrong. In your expertise, what is it that you would like to see in terms of protocol to allow getting back to the field to be safe? And the second side of that is that even possible, the safety without daily rapid tests?
So here's a few things I would want to see, and I think to some degree that this model has been adopted thoughtfully in some states. I don't, at a top level, I don't know how a school district responsibly restarts sports without at least some cadence in testing. It doesn't, this is where there's failure of government. Yes, I think we can't expect a school district, public school districts especially, to cover the cost of testing because it's darn expensive. And it's just unfair. It's expensive for every American family, much less public school districts. And so what we're doing is what I'm seeing is we're having private schools who can afford heaven and earth when it comes to testing, but you can't. That model is creating have and have nots because a lot of people can't. I actually have right here. I show this on air often whenever I have the platform. But this is an example. I won't show you the name of the company, but this is an example of a rapid point of care test. This costs $300 and then $25 on top per test. And it requires some degree of technical skill to perform. Is there any reason why every American family couldn't have one of these? Probably not. I mean, $300 is a lot of money, but and $25 a test is a lot of money. But we're having a once in a lifetime pandemic. I think we should be able to figure this out. I think testing has to happen, but is it every day? We know we can't do that like the NBA or MLB. But could it be once a week? Or maybe once every 2 weeks based on what's happening in the surrounding community? I'm seeing the metrics on what's happening in DC, Virginia, and Maryland. Your degree of infection, take your metric that's your favorite. There's a problem with every single one of them, but say test positivity, yours in DC I saw is about 1.6%. That you could argue that if you tested everybody, say every 10 to 14 days, when community transmission rates are low, and then you would have a reasonable sense, not a perfect sense, but a reasonable sense of what was happening with virus transmission in a school setting. And so testing at the top level, to me, every 10 to 14 days should be table stakes for anybody to say, yes, we're going to start football again. And that should be the priority of government officials, local, state, to help fund. It's not going to be easy, but in the next few months, we're going to see a tsunami of cheap rapid point of care tests hit the United States. And I think this is going to be an easier conversation to have come basketball season. But for football season, I would say it's going to be a little tricky, but every 2-week testing to me seems reasonable and a reasonable expectation, especially for our athletes. So that's number one. Number two, I think ventilation matters. So it's the type of activity that matters. Are we talking about indoor volleyball or are we talking about outdoor football? We know outdoors is a protective benefit. It protects against transmission of the virus. Being in indoors is difficult. So as we move into the winter and we think about indoor sports, that's going to be challenging because we know we're going to have HVAC and ventilation systems that are up to date. But even then, it's not going to be the same thing as being outdoors. So, spacing, being outdoors is helpful. In the winter months, it really brings to bear that you need to make sure you have a testing protocol in place because you're going to be indoors. And we know the risk for transmission is much higher indoors. Other common sense things for non-vigorous activity, individuals should be wearing masks. You can't obviously wear masks when you're running on the 50-yard line or dribbling up the court, but coaching staff, players on the bench, any audience members that might be present that are socially distanced, they should be wearing masks to whatever extent possible. And then obviously infection control, common sense stuff that you don't need me to say, but hand hygiene, soap and water, things of that nature. I mean, this can't just be like everything is normal again. Locker room behavior, things of that nature. There needs to be some degree of rethinking about what does the locker room look like. As somebody that participated in high school sports eons ago, you can't have. I see what happens in terms of hygiene. I understand what happens. It's not the greatest hygiene, especially in a men's locker room. So we would have to think about do we even close down the locker rooms? And people are expected to shower at home. So it's that type of approach. But again, without testing, I think you're flying blind. And so if I'm a school district and I want to open up football, I'd say that how can we at least get Q2 week testing? Is that possible? And there are ways to do it. Saliva Direct, a platform developed by scientists at Yale, is developing a fairly rapid test. It's still about 24-hour turnaround. It's the test that the NBA used. And I'm in constant communication with these guys. And it's about less than $10 to test. You spit into something and you get clearance. That is an example of the type of testing that we're going to see more and more in the months ahead. So this will be an easier conversation to have. I know it's difficult right now.
I want to dive deeper into the point that you made a moment ago there, and then we'll turn it over to the audience to be able to ask you of their questions as well. But you spoke to the locker rooms. Listen, not only do I love youth and high school sports, it is a portion of what allows for me to live as well. So I want for high school sports to be back, not only for myself, but especially for the student athletes. But I do want for them to be safe, and I want for their parents and their parents' parents to be safe as well. You spoke to locker rooms. When I, as a former student athlete, not a very good one, albeit, but as a former student athlete, locker rooms, not the most hygienic places. They're a bit of a petri dish. Do you think that it's even possible? Is it possible on a high school's budget to have locker rooms open and still remain safe and do the best things for the students?
If I was in charge of, I advise a few companies on workplace health and safety rules, and in some cases, because it's either cost prohibitive or there's other reasons, we shut down bathrooms, or we do frequent cleaning of bathrooms and sanitation procedures that are quite rigorous, depending on what can and cannot be afforded. For a high school, that I'm assuming, all high schools, a lot of high schools, especially public high schools, are cash strapped. I'd shut it down. I would expect students, if possible. I recognize that they would probably have to change for practice. So maybe you would have to figure out a space where individuals could change for practice. But in terms of showering, using the sinks, using the toilets, I would prevent the ability to for bodily fluids and for an unhygienic environment to easily present itself. Do you open up the part where people can actually just change in a private space across gender lines or whatever is culturally sensitive? Sure. I think that to me is reasonable and practical, because I think what we have to focus in on here is, I can come here on to this panel and give you what is scientifically rigorous, and all of you are going to say, like, that is absolutely not practical. Do what the NBA did, and you're not going to have a single case. But you know what the NBA did? The NBA is obviously rich, and they're able to do things that no normal person can do. So I'm trying to be practical here. Shutting down the locker rooms, I would shut down the toilets. I would shut down those things in the locker room themselves. Obviously, you have to have functioning restrooms somewhere in the environment. You have to have cleaning procedures that are much more rigorous than what would otherwise be present in normal times. I think all those things are pretty overcomable and practical and not unreasonable. But I would try to do risk mitigation to the extent possible. So masking, distancing of the benches, minimizing audiences, or entirely removing the expectation of audiences being present. And then you need to have testing in place. It's vital, in my view, to have some type of testing program in place so that teachers, custodial staff, coaches, and then students know what's happening in their actual environment. You cannot look and see what's happening in the surrounding community and assume that that's what's happening in the school setting. We've seen from the University of Wisconsin-Madison, the University of Iowa, examples where the school is the actual super spreader location for the surrounding community. So let's be clear here. I want to make sure I'm doing right by all of you. I think there's a way to restart sports safely and practically and affordably, but it has to involve testing.
Has to involve testing, and everyone has to be on the same page. Dr.